Although it's been around for decades, telemedicine really saw a rise in use during the pandemic.
Dr. Aditi U, Joshi is a leading expert in the field, a recognized top 25 under 45 influencer, and joins us now. Good morning.
Good morning.
How are you doing?
I'm well.
Good.
Thanks for having me.
Telemedicine, as Jessica just kind of referenced, has really exploded over the last few years. How has it transformed or reached patients who wouldn't normally have immediate access to that medical attention?
Absolutely, especially in emergency medicine, right? Nobody wants to go to the ER, and that's when people really need immediate access to care. So we've been able to expand where people can be and deliver and get healthcare, right? You could be at your home, you could be at work. And so now people can dial in at any time, and that's really transformed how we think about healthcare and how do we think about emergency care.
Yeah, and we referenced, obviously, there was like this big boost that happened during the pandemic. So what are some of the most significant ways that telemedicine has improved a patient's outcome?
So one, they can go and get access from wherever they are. So if you're in a rural area or you don't have access to a specialist, you can now do that. And then second, if you're in some place where you don't have the doctors available to you, you don't necessarily have to travel. You can see them. And then third, and I think one thing that people don't realize is, so there are people who don't feel safe getting healthcare, or they're in places where they're maybe afraid. And so now they can actually access someone who can understand them, who is culturally competent. And so they can feel a little bit safer getting healthcare.
Yeah. Are there any specific examples that you know of, or you can share, where it's transformed someone's outlook or saved someone's life, where they may not have had the ability to even realize there was something wrong with them?
Absolutely. I mean, I've seen so many patients in emergency care. Well, I had a patient once, didn't realize that some of the symptoms that she was having were actually potentially symptoms of a stroke. She thought she was just having symptoms of a sinus infection. So I told her, I was like, listen, it may not be a stroke, but you need to go in and get checked out. Or another person, especially in women, they don't have the same symptoms for heart attacks. So I would send people in and say, you need to get checked out in person. And this is valuable information because you just don't know. And then it delays your care. And then you could have worse outcomes. And we don't want that.
Right. And how has telemedicine really changed the patient and doctor experience and relationship there?
There's two ways. I think it's incredible because patients now have better ability to take control of their health. They can get more information. They can take care of themselves at home. And I can sit in the home and say, okay, well, let's look in your medicine cabinet. Let's see what's going on in there. Maybe this is a problem. Or let's walk around. What kind of allergens might be potentially causing your symptoms? Or are you at risk for falls? Those are all things that you can't do in a clinic, but I can walk around the house. And so now patients have better information. And so instead of just trying to think through it themselves when they get home, we can do it together.
Yeah. In some respects, telemedicine is almost like a better mousetrap because it alleviates the need, like you said, for someone who may not have the ability to go and see a doctor. But everything comes with challenges. So,
yes.
What are some challenges that you've personally faced with this area of expertise, and how overcome those obstacles?
Yeah, so I'll say for my colleagues, emergency medicine isn't the most obvious thing people think of to do virtually. People wonder, well, how can you do that? It's a high-risk environment, and the complaints can be something very serious. But, we realize that there's so many touch points that we can look at and say, all right, where does a patient need to see? What kind of information do they need? And so trying to convince colleagues and say that it's safe and you're still going to get quality of care, that's one challenge. And on the flip side is patients feeling safe doing it. And then also knowing that they have this available and when to use it and how to use it. And so that takes a lot of change in society, culture, and just in the house of medicine, changing our outlook on what technology is and what medicine is.
And you mentioned patients being able to know where and how it's available. So what's the best way for them to find depending on what it is that they need?
So I would say if you have, like you guys have great healthcare in Vegas, right? You have big hospitals. I would check in with your doctors and who you're getting healthcare from. Do they offer this? Is it available? And start there first, right? Someone that you already know. If you can't find that, there are other options, right? There are hospitals or there are companies that also deliver care. I would actually make sure that you're looking and seeing somebody who may be referred to you or your doctors refer to you if they don't offer it themselves, because there's a lot of companies out there, and I know that we don't want people to get just subpar care, and so sometimes that is being offered, unfortunately.
Well, thank you for this. It's really insightful. I'm sure a lot of people out there who could really benefit from this. But we'll hear that this
Yes.
morning. So thank you for coming in, and to find out more yourself about Dr. Joshi's work and to learn about her best-selling book, Telehealth Success, head to draditiujoshi.com.